Should physicians apologize for medical mistakes? Find out on Medical Economics.
Saying that you are sorry for the outcome is not the same as saying, and it was my fault, okay? So it is not meant to shield any admissions of liability. And in fact, of the 39 states that have apology laws in place of some sort, 34 of them in some way, 34 states in some way say, but by the way, admissions of liability are not covered by this section. So one thing is to realize that it is not a shield that's going to shield you from whatever you may say about how things occurred in the procedure or treatment.
Should physicians apologize for medical mistakes? In the past, doctors were often told to avoid expressing sympathy for a bad outcome. The fear, of course, was that it would be used against them in court. But the conventional wisdom regarding apologies is changing. Now the answer to the question, should you apologize, is it depends. In part, this trend has been driven by the growing number of states passing so-called apology laws, which prevent apologies to patients from being used as an admission of guilt. Regardless of the laws in your state, experts say there are ways for doctors to apologize and express empathy without saying they are to blame. Today, we sat down with malpractice attorney Fred Cummings to discuss when you should apologize to patients and how you should do it. How has the ways that physicians talk to patients about bad outcomes changed over the years?
I think that the way physicians speak with patients about bad outcome has changed because of patient demand, that patients now are demanding to know about their medical care. I think back many years ago when I first started doing this work, and I won't say how long that was, is that the natural defensive mechanism was to deny and defend. In other words, I'm going to deny that outcome was anything to do with me, and I'm going to defend my care. Now, with the advent of the internet and patients seated with the adage of a little bit of knowledge is a dangerous thing, really need an explanation as to the bad outcome because you don't know what other resources that they are looking at that are readily available to them that now may cast you in a more negative light than what reality really is. And so I think physicians recognize that. They recognize that in their day-to-day practice because patients are suddenly asking questions I saw on the internet that, and then, you go, oh no, I've got to unwind this, right? And so it's much better to be upfront about the bad outcome because otherwise you're going to leave it to the patient's own devices to find out what happened. And that may not be in your best interest.
In general, what are apology laws and how do they benefit physicians?
An apology law essentially is this. It's an attempt by state legislatures to try to reduce malpractice risk for physicians to be able to then to talk to their patients about a bad outcome and express empathy without worrying that they are admitting fault or admitting liability. It's basically trying to help codify good behavior for a physician to say, oh, I'm sorry that this outcome happened for you. There are I'm sorry laws in 39 states. So 34 of those states are what we call limited sorry laws. Basically what happens is if I have a bad outcome and I apologize to you and say, I'm so sorry about this outcome, that cannot be then later used in a trial as some sort of admission of liability. And that's the purpose of these laws. There's some question as to whether they're effective or not. There have been studies that have gone both ways. Where I think the more effective studies have shown that I'm sorry laws are effective are in hospitals. Hospitals have, in fact, put in place sort of a acknowledge, investigate, explain system that I think has worked well for the hospitals. And they, I think, statistically have shown that hospital claims have gone down. Physicians not, the jury's still out, so to speak, on that. And I've seen studies even as recently as just a year ago that would suggest that I'm sorry laws aren't quite having the same impact on the number of claims or the ability to settle a claim for a reasonable amount as perhaps what was once thought.
What impact does a sincere apology have on a patient who might be considering a lawsuit?
Well, well, first of all, I think just human nature and intuition tells you that if you show empathy to a patient, that's already going to do something to reduce their anger, to make them feel like their outcome is really an outcome, that they're not just imagining it or you're going to try to explain it away. So I think just from that aspect, it does have a beneficial effect. Now, does it reduce the number of lawsuits? Hard to say. First of all, is because we really don't have any hard studies about that. We don't ask every person that has received an apology from a physician, so are you going to sue now? So we don't have any way to really measure that. But so there aren't really any hard statistics that they're less likely to sue. But I think that outside of the hospital setting, which I just alluded to, I do think that just human nature will tell you that it will lessen your chance of receiving a lawsuit.
What is the record on apology laws? Have they actually helped prevent lawsuits or helped physicians in court?
Well, I think the benefit of apology laws have been seen before you get to court, because the whole aspect or the whole reason for an apology law is to keep the apology out of court. So I have seen it be effective in that way, which is that just in terms of seeing the reaction of patients and how they react to the physicians that I'm representing, I think that the better the relationship the physician and patient had before the lawsuit, usually the easier the lawsuit is for the physician, the better it goes for the physician and patient in terms of having to try to resolve a claim or lawsuit. But in terms of the practical aspect of apology laws and whether they've had any real impact on outcomes of trial, I don't think anybody can really say. I don't think there's any way to measure that.
What are the problems with apology laws that physicians need to be aware of?
Well, first of all, saying that you are sorry for the outcome is not the same as saying, and it was my fault, okay? So it is not meant to shield any admissions of liability. And in fact, of the 39 states that have apology laws in place of some sort, 34 of them in some way, 34 states in some way say, but by the way, admissions of liability are not covered by this section. So one thing is to realize that it is not a shield that's going to shield you from whatever you may say about how things occurred in the procedure or treatment. So the other negative aspect of it that sometimes some commentators say is that depending on the way you deliver the apology, you may tip off the patient to a potential claim that they weren't even thinking about at the time. So again, it's important while you can demonstrate empathy, but not to such a way where you are then casting any type of blame on yourself or even others.
What are some examples of things that physicians should say to a patient after a bad outcome?
Well, I think, again, it all goes to communication and making the patient feel like you really do have their best interests in mind. So first of all, I think if there's a bad outcome, you certainly can just say, look, I'm sorry. I don't know what happened, but I do intend to investigate. And then I'll come back to you and explain, what happened. Those sort of, I'm going to not stick my head in the sand. I'm not going to ignore this. I'm not going to pretend it didn't happen or that I don't have some role in it. It's just, let's find out what's happened and let's take care of it. Let's see what it means for you medically. And then this is the plan going forward. That goes a long way to, again, making the patient feel like they're being cared for, that the physician is interested in what happened, and that they themselves will feel like the physician is going to come back to them. It's when the questions are unanswered and the physician then doesn't go back to the patient and explain what happened that gets the physicians in trouble.
So the opposite question, what are some things that physicians should avoid saying to patients after a bad outcome?
It was my fault. I'm sorry that happened, but don't then add, so I'm sorry I wasn't paying attention. In other words, anything that might impact on the cause that would reflect either on you or on others. Just as frequent an occurrence is when a physician in a very defensive posture feels the need to blame others. And we really don't want to do that. The second thing is, and a lot of times we don't know really what happened, do we? We kind of have an idea, but this is not the time to speculate or assume certain facts took place. If you don't know what happened, or you only know a little bit of what happened, then you don't want to speculate as to what happened, because patients will remember what you said. You may not remember what you said, but the patients will. And so it's important not to speculate as well. And obviously, whenever something like this happens, you don't want to then go back and try to change the records to, in some way, deflect attention to whatever your position or your participation in the outcome might have been.
When it comes to apology laws, what is the role of documentation? I guess what I'm asking is, what should you document when it comes to the apology itself?
I don't know that it's necessary to put in the medical record, and I apologize to the patient and gave condolences. But what you can do is say, you do want to document. I went to the patient or the patient's representative and told them what happened. And then I gave, as best an explanation as I could as to what it means medically for the patient and what the plan going forward was. Again, you want to document all of that. In many ways, of course, is if in fact the outcome is one that was anticipated because it's a risk of a procedure, you certainly want to highlight in your documentation that this was something that is an unfortunate risk or complication of this procedure, as discussed with the patient, because you will have, of course, documented your informed consent discussion with the patient beforehand. And so in that way, the documentation can be very important because it can connect the dots. An issue that was discussed with the patient before the procedure, outcome that happened that was previously discussed. You then document that you discussed that and what you plan to do about it.
It seems to me that a good relationship with patients is sort of the important factor of an apology. Can you talk a little bit about the importance of the physician-patient relationship when it comes to both apologizing and preventing a lawsuit?
Well, absolutely. I think the more that you, as a patient, trust your physician and that you believe the physician has your best interests at heart and the physician will listen to you, that goes a long way, right? And so it's just human nature. And again, don't forget how it is for you to be a patient and what you want to know, although we all know that physicians make the worst patients, right? But at the same time, one of the reasons is because they know what should be happening and what a physician should be talking to them about. So obviously you want to always encourage communication with your patient. You want to always encourage questions. You don't want to avoid not answering, you don't want to avoid answering their questions in any way, shape, or form. And the reason is because if a patient has a good feeling about this relationship, and they understand that sometimes either mistakes can happen or outcomes that aren't anticipated may not be your fault or may just be something that happens, they're going to be a lot more understanding about that if they feel good about you, as well as that you have given an explanation as to what happened. So they don't have to try to figure out what happened and use litigation as the mechanism to do so.